So Nanette and I leave that first meeting with Beth Sweeney on September 22nd, 2014. Um, kind of sort of satisfied. She started me on a birth control pill that was supposed to help with the inflammation that she said was causing all of that pain that was south of the border, down the legs. Um, she didn't send for Boones ultrasound. She wanted to see if that helped. She offered refills. I declined on the refills. At that time, I was not working. I was in a small apartment paid for by the Central Missouri Stop Human Trafficking Coalition and Project Innocent. I ended up having these ongoing irregular bleeding patterns with any type of sexual activity. I'm not talking about sex with other people. Any type of arousal or orgasm started me bleeding and excruciating. Like tears, pain, down south of the border. And I was sending Beth emails to the patient portal, and I'm really embarrassed about talking about this because I just told her I wasn't dating anybody. So we're talking about self-stimulation, and I'm like, okay, I haven't never had to talk to a doctor about this before because I've never had it cause problems, obviously. And I'm trying to be flippant about it so that I get this, everywhere else I've lived, everybody just talks about it's no big deal, but this is the Bible Belt. So I'm trying to be conservative and joking about it and bold about it because it was really causing concern, and I now know that it was cause for concern. These were symptoms of cancer, not a benign fibroid, muscular fibroid. What we didn't know, because the ultrasound was old, was that tumor was growing very rapidly inside that teeny tiny little corn of the uterus. And I said, Beth, now I've got numbness and tingling down there too. This is like really driving me up a wall here. This is my private. I may be an old fat lady, but I really don't want to lose access to multiple orgasms. She takes it in stride. She doesn't say anything smart. She doesn't say anything disrespectful. She has me come in. I had to show her exactly where I was having the tingling sensation. She said that this uterus is causing, there's inflammation and it's pressing on that nerve. And I think we discussed medication, and I said, I really don't want to be numb because I'm already struggling to have any sort of, sexual feeling south of the border anyway. I really don't want any more medication. My sex drive is more important to me and that I really don't like the side effects of narcotics anyway. It makes me foggy, it makes me irritable, and I recorded, me telling her this, and it was even on the last visit. And a friend of mine named Katie saw what happened when, they administered narcotic pain reliever after surgery. I was really very irritable, and I was disoriented. I was like, don't give me any more, don't give me any more of that. And it was fentanyl, which is synthetic heroin. I'm like, don't give me any more of that. Please give me ibuprofen. I've had enough of that. I don't want any more of that. So it causes problems with the autism because we're super sensitive to it, and it just really throws us off. And we get irritable, and we're short, and Beth she understood. She understood that I didn't like taking it. I wanted the situation remedied. She says, I'm going to put in, this was a visit, I believe it was like October 17th, something like that, of 2014. She saw me again. She says, I'm putting in for you to see Dr. Elizabeth Wilson. She's an OBGYN. She volunteers over here once a month. I'm getting you in to see her the next time she's here. Actually, I think this was earlier in October. I think I saw Elizabeth Wilson on the 17th. I continue to take my medication very conservatively. I don't believe I asked Beth for any refills in all that time. Beth Wilson sees me. She's immediately concerned, immediately wants to do a biopsy. Tries to do an endometrial biopsy there at Family Health Center. Nobody has sent for Boone's records. I recorded, Nanette was sitting there with that visit with Elizabeth Wilson. She sat there, I recorded myself telling Beth 1,000 times, there's an ultrasound at Boone. I don't know what it says, but whatever it was, I didn't like the look on his face. Somebody please, I never occurred to me to go. I believe I was told that it cost me $25 to get my records, so I didn't have $25, so I didn't go get them. Otherwise, I would have. And I recorded their medical records, people saying nobody ever sent for that ultrasound until November of 2014 to be able to see that that tumor was there. So Elizabeth Wilson's immediately worried about, getting a biopsy. She attempts an endometrial biopsy, and whatever it is she does, while she's got me in the stirrups, I about go off the table. And I was medicated. I made sure I took medication before I went in there because I figured she was going to do a pelvic. That was always really aggravated everything, made bleeding worse. It just made everything really bad. And this was crippling pain. I said that the birth control pill seemed to help a little bit, help the narcotic help better, but it still didn't stop the bleeding and the really bad crippling pain that could happen out of nowhere. Not necessarily out of nowhere, any type of sexual stimulation going on south of the border. Or, I don't remember what else set it off. It was little things that could start me bleeding. And I was already bleeding very heavily, and I would stop bleeding heavily and then have these little bleeding episodes, which got worse and worse. Elizabeth Wilson, while she had me up in the stirrups, well, maybe this is all because you were abused as a child. And I'm like, no, she didn't just say that shit out of her mouth. All this bleeding, what the hell does that have to do with 35 years ago being abused, sexually abused as a child? What the hell does that have to do with it? So I made me very uncomfortable. In the meantime, I call Family Health Center for something. I don't remember what it was. Oh, I started having real nasty, sharp chest pain, stabbing chest pain. And I called, and some nurse really just thought it was hilarious that I asked them to send for Boone's medical records to show that there was something on. Maybe I wasn't, maybe the pneumonia didn't get knocked out. And she was really hateful. I'd had enough with all their hateful attitudes. And I just recorded them doing it again recently. I'm bleeding. I'm unable to work as a political fundraiser anyway, with all the setting in the 9 points that you have to be able to concentrate. I call and have about an hour and a half conversation with the clinic manager, Rebecca Leach, and basically lecture her about the discrimination and the rudeness and the witnessed rudeness by Nanette, who was a former human rights investigator, who certainly agreed that the behavior down there was rude as hell. And I said, I promise you, they're probably falsifying, and I was talking to Rebecca Leach, I said, they're probably falsifying the medical records, because no way they're recording how hateful they're being, and the fact that they're refusing to send for the ultrasound, refusing to send for records, and, making all these references to psych, when they shouldn't even be worried about that. They should be worried about, let's get this bleeding dealt with. Let's look at this ultrasound, rule anything serious out, and then, if after we get all that taken care of, she's still having issues, then we'll deal with that at the time. But I don't see other people's being uncomfortable with my autism as something I need to medicate. That means they need to get some sensitivity training. That's how I look at that. And it's just basically them being unaccommodating. And what happened after that was Elizabeth Wilson falsified medical records and falsely billed me for a biopsy that didn't happen. I'll get into that with the next video.